Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. And you can also visit my playlist. In the playlist I have provided almost all the topics in a systematic order. It is quite convenient for the study. My dear friends, we are discussing about fever in children. We have seen almost all 8 or 9 classes regarding approach to fever in children. In the last class we have seen what is the nature of the parasite. Now, another important cause of the fever is non-infective inflammatory causes. So what is the meaning of this? There is no, as if there is no infection evident, but still there is inflammation. Now we know that usually inflammation will be there in tissue injury, and the most common cause of tissue injury is injury is infection. But without infection also sometimes there will be inflammation and fever. Okay, with the inflammation there is a fever and inflammation. With the infection there is inflammation and as well as fever that is evident. But sometimes there is a fever and inflammation, both are there, but there is no infection. So such causes are considered under the heading of non-infective inflammatory causes of the fever. Now what is the cause of the fever? There is no infection. Suppose in this case, actually, the exaggerated body immune mechanism is responsible for this inflammation. Without infection, there is inflammation, means this has to be thought, isn't it? So without infection, there is inflammation, means that inflammation is not occurring because of infection or infectious agent. It is occurring because of a exaggerated body immune mechanism. What is the meaning of that? Now suppose a patient is there. He has got a viral fever few days back. Okay, viral fever few days back, and the fever has come and fever has gone. Now because of the viral fever, the body immune system is get overexcited and it start producing some antibodies against particular body tissues, maybe in the joint, maybe in the renal system, maybe somewhere else. Now some of the antibodies are produced by the body immune system which are going to damage our own body tissues. Why these antibodies are produced? These antibodies are produced by the body immune system only, but a stimulus for production of these antibodies from the immune system is a previously attacked or previous episode of viral fever. That previous viral fever attack, so that causes over-excitation of the body immune system, and body immune system is get deranged or confused to some extent, and now it start producing some antibodies against our own body tissues, thinking that these body tissues are also the microorganisms. Okay, so this is actually what is happening. So in this case there is no infection. If you look into that, there is no infection, but still inflammation is there. Why that inflammation occur? Because autoantibodies, they go and attack some of the body tissues. Antibodies or autoantibodies. Now when they attack, the tissue damage takes place, and as a result the antigen antibody complexes are formed there. It deposits there. So local tissue damage takes place and inflammation takes place. Then fever comes. So here also there is fever, but cause is non-infective. So all autoimmune group of disorders, okay, all autoimmune group of disorders, they come under the heading of non-infective inflammatory causes of the fever. So body immune system misread our own body cells as pathogens, and they will go into attack. So there is rushing of immune cells to the spot, and deposition of the immune complex will be there, and this leads to local inflammation and fever. And all autoimmune causes, maybe rheumatoid arthritis, maybe other immunological disorders, SLE, rheumatic fever, Kawasaki disease, nephritis, vasculitis, they all comes under this particular category. So what is this? Fever is there, but there is no infection, but there is inflammation. Okay, so this type of fevers has to be differentiated from other viral, bacterial and parasitic fever. So how to differentiate this type of fever, that is non-infective inflammatory fever, or we can call it in otherwise immunological fever. So viral fever, bacterial fever, parasitic fever and immunological fever. So how to differentiate this immunological fever from the rest of the fever? So non-infective inflammatory fever can be also called as a immunological fevers, because basically this is mediated by the body immune cells. Immune cell is producing the antibodies and it is causing the damage. Okay, so this is another important aspect. So these are the 4 important fever that we should know. One is viral fever, bacterial fever, parasitic fever, and immunological fever. The rest of the things we will continue in the next class. Thank you very much.